The League of Women Voters collaborated with us here at the Needham channel to present their annual Candidates Night. At the 2018 town meeting, the members voted to add 2 additional seats to the Board of Health. There are 3 candidates running for the 2 seats. The person with the most votes will be seated for 3 years, and the candidate with the second most votes will be seated for 2 years. Here's a look at their opening statements.
My background is in public health. I've worked both domestically and abroad in community health worker programs and in health worker retention during the height of the HIV/AIDS epidemic in Southern Africa. Most recently, I worked in the Rhode Island Health Department on tobacco control policy, and currently, after having 2 young children, I am working part-time in health communications, doing writing and campaign planning for various health initiatives. There were 2 main reasons that I decided to throw my hat in the ring for the Board of Health. The first is that I truly believe the saying that democracy is not a spectator sport. And as I was considering this role, I saw a car in the Trader Joe's parking lot with just that bumper sticker. And I thought, you know, this town has served our family well for the past 4 years, and I hope to contribute in whatever way I can to sustaining this town. And secondly, I've been inspired by the people of Needham. I serve as co-chair of the Needham Human Rights Committee, and I've met wonderful people in town who are doing their best to ensure that Needham represents all of us. And so I look forward to serving the town further. Thank you.
To the voters, I'd like to say that public health is a very important issue. I know because I manage public health issues every day. I'm an ER doctor with 30 years of clinical experience, a master's in public health, and an intimate understanding of health issues affecting people of all ages. I'm also a longtime Needham resident and parent of 3 NHS graduates. When my kids were younger, I coached their baseball and softball teams. Now that they're grown, I have time to work on the board and serve my fellow Needhamites with my years of experience in public health. My goal is to promote and preserve community health initiatives that benefit all Needham residents. I have a good foundation not only in the science behind public health, but also how education, prevention, and appropriate regulation can improve community health, especially with regard to pressing issues such as smoking, vaping, substance abuse prevention, healthcare access, senior health, sports injuries, and teen safety. I have both practical and academic knowledge of best practices in public health. In addition to working clinically at Emerson Hospital, I'm on the faculty at Brown University Medical School and have written numerous articles for health journals. I received my medical degree from Tufts and my master's degree in public health from Harvard. I would be honored to work with the others on the Needham Board of Health to improve health conditions for all of our residents and to set a high standard among other local communities.
So my family has lived here since the mid-'80s. They moved here from Ohio. So I was born and raised in Needham. My wife and I just moved back with our 2-year-old daughter, our dog, and we have another daughter on the way. So I'm deeply committed to this town and trying to improve it as best as I can. With the constant reports of climate change, disease outbreaks, bullying, opioids, suicide, and more, I fear, as most parents probably do, for the world that their kids are going to inherit. And I've never been the type of person to just sit and watch when there's a problem or an issue. I've always tried to roll up my sleeves and do whatever I can. So now that I've got roots here in Needham, I want to get involved. I think the board has a broad enough reach that I can use my diverse experience in a lot of different areas to affect positive change in the community. So I'm not a doctor, I'm not a nurse, I'm not a scientist, I'm an entrepreneur. I've got a handful of different experiences that I think would make sense for the board. I've worked with at-risk youth before. I've studied social change and environmental issues. I've worked as a server in Needham. I've coached both youth and adult athletics. I've worked as a sales support person all the way up to COO and CEO of companies. That's been a wide variety of industries. So I bring a wide-angle view to the Board of Health with the ability to think proactively, not retroactively. I don't want to wait till an issue pops up to address it. I want to try to see around the corner. And I want to be a conduit for information and exchange and positive change for the community.
The entire League of Women Voters Needham Candidates Night is available here on the Needham channel and on our website. Go to needhamchannel.org to view the programming schedule or to watch the video online. The election will be on April 9th.